Okay, so I'm going to be talking about creatine supplementation and the rules beyond athletic performance. So the reason that I chose this topic was because I've had a few people ask me what creatine does, and honestly, I didn't know a whole lot about it. And then I had this preceptor, and he told me that he was taking it for athletic performance, but that he was also taking it for cognitive performance. So I thought that was really interesting. And since talking about supplements is the RD scope of practice, I just thought that this would be something to talk about, something interesting to talk about for my presentation today. So we're going to be talking about what creatine is, the sources of creatine, its safety, the possible benefits, my research articles, and how the RD can play a role in this particular subject. So what is creatine? So creatine is a naturally occurring amino acid, and it's located in our body's muscles as well as in the brain. It can be made synthetically, either through supplementation such as powders or tablets, but you can also get it from food sources as well. So basically, the body converts creatine to phosphocreatine, and it stores it in the muscles where it's used for energy. So as a result, athletes take creatine to improve athletic performance, and it helps give you that extra energy when resting between workouts. So the theory is that supplementation can build up a reserve of creatine in the muscles and use it as energy on demand. So there are different ways you can get creatine from food. You can get small amounts of creatine through different types of animal protein products, such as beef, pork, fish, and organs. And as you can tell, there's not a whole lot of creatine per ounce. So men, on average, they get about 1 gram of creatine per day, which is about 56 grams of animal protein. And for women, that average is just under a gram of creatine, which is about 46 grams of animal protein per day. So how does creatine work in the body? So I'm just going to show you the quick steps on how it works. So ATP is your body's energy source, and it's ready to be used. So as you expend that energy is then depleted. This depleted ATP will produce ADP as a byproduct. And when you use up that ATP, it really takes time and food to get that energy back. So this is where creatine comes into place. So phosphocreatine will donate one phosphate, and ADP will then be converted back to ATP. And then this newly generated ATP gives you more energy for a certain amount of time. So creatine essentially replenishes the system during rest, and this explains the popularity among athletes and how they get that energy that they need. So is creatine safe? So creatine is actually the most studied supplement in the world, and according to the International Society of Sports Nutrition, creatine shows to be safe for both short and long-term use, but it's really based on the amount of supplementation, your age, your gender, how long you're going to be using it for, and what it's going to be used for. The only side effect that might be a possibility is the potential of bloating from water retention, and this occurs in some certain types of creatine, specifically creatine monohydrate. And then there's no evidence that it can cause any type of GI upset, dehydration, muscle injuries, or renal dysfunction. It is not recommended, though, for somebody who already has a pre-existing kidney disease, because it's going to be harder for your kidneys to filter out this supplement. So the primary benefit of creatine is for more energy for exercise. So for this purpose, creatine is well researched. There are many other studies, though, right now that are trying to figure out if it can be beneficial in other areas as well. So these areas are things such as increasing muscle strength in those with heart failure, treating Parkinson's disease, different types of arthritis, ALS, cognitive development, and even depression and bipolar disorder. But unfortunately, since it isn't being studied largely yet in other areas, medicinal use of this product has not been approved by the FDA, and this is why people aren't being prescribed creatine at this time. So while I was doing my research, I found that there are far less articles regarding these other possible benefits or these other areas than there are for athletic performance. So what I wanted to focus on specifically in my research today is how creatine can really improve cognitive performance. So based on research, the brain is very responsive to creatine. So our brain depends on energy for proper functioning and for cognitive activity. And creatine is important since it can help replenish those energy stores. So during a cognitive task, your neurons actually put a pretty high energy demand on the brain. And our brain will pretty much fatigue during these bursts of cognitive activity because there just isn't enough energy. So this is where creatine supplementing could come in handy. It just can help replenish those ATP reserves pretty quickly. So basically, the more creatine that's found in the brain, the better the brain reacts to these cognitive tasks. So these are just a few topics on creatine that have been researched on for the benefits of cognitive performance. So things such as reduction in mental fatigue for things such as mental activity. Oop. Is somebody's hold on. Sorry about that. Somebody's audio was turned on. Okay. So yeah, these are things that such mental fatigue can be demanding mental activity, sleep deprivation, traumatic brain injury, mental fatigue from exercise. And then it's also showed to help improve working memory. So those with lower animal protein intake, such as vegan and vegetarians, the elderly individuals. And then that's also being used as an adjunctive treatment for depression. Okay, so we're going to get into my research articles. So the first one is oral creatine monohydrate supplementation, how it improves brain performance. So creatine monohydrate is just a specific type of creatine supplementation, and it usually comes in a powder form, and it's the most popular among consumers. And then the purpose of my study was to determine whether creatine can have a beneficial effect on mental performance if the creatine reservoir in the brain were increased in those with the lowest creatine levels, such as vegetarians. Okay, 45 people were selected to complete this study. Both men and women between the ages of 20 and 40 years old participated. And then those to be included had to be vegan or vegetarian, and they also had to be students at this university. So since creatine appears naturally in animal products, it was important in the study to see how creatine would really affect those with low creatine stores by researching those who are on a vegan or vegetarian diet. And then those who are excluded from the study, they could not have any medical history of drug or alcohol abuse, no diagnosed psychiatric disorders, no diabetes or renal insufficiency. So this study was over an 18-week program, and all subjects were randomly assigned to a group, and they were given an envelope marked with their study number, and it contained 5 grams of either the placebo or the creatine supplement. And then they were each of them, half of them were in the intervention group, and half of them were in the control group. And then the primary outcomes of the study was just to test the working memory, and they did this by conducting 2 different types of cognitive tests, and these tests were called the RAPM and a Welcher's auditory BDS test. And then the secondary outcome of the study was just to determine if taking creatine was symbolic of tissue creatine levels in the brain. So for the results, most of our subjects were pretty much compliant with taking their supplements. And then for the red blood cell creatine levels that were tested, it showed a significant increase of creatine with this supplementation. For these cognitive tests that were completed, the RAPM test and the BDS test, both the intervention group showed a significant increase in intelligence compared to that control group. So if you look at these pictures, you can see that each test had similar scores. So from week 0 to 6, cognition levels went up when taking those creatine supplementation. And then from week 6 to 12, this was a washout period where they did not take the supplement, and you can see that the cognitive levels went back down to baseline with that creatine. And then from week 12 to 18, the cognitive levels went back up. So each visit resulted in an increase in cognitive performance with that creatine supplementation, and this showed significant outcomes. So in conclusion, increasing creatine intake by oral supplementation resulted in improved brain function, reduced mental fatigue, and correlated positively with recognition memory. So based on my EAL worksheet, I gave this study a positive score. For the strengths, it was a randomized double-blind design, so everybody who participated in the study was blinded to the groups. It was over an 18-week period, so there's plenty of time to take these supplements. Nobody dropped out in this study, and since of the positive outcomes with cognition, it is applicable outside of the research setting. And then for limitations, there was no record of current supplements or medications that were being taken. And then no biases or study limitations were discussed. All right, so for my second article, we're going to be talking about creatine and if it can combat the mental fatigue associated decrease in visuomotor skills. And the purpose is to determine if taking creatine can counteract mental fatigue impairment in sport-specific visuomotor skills regarding mental control and movement. So in this study, 16 people were selected and 2 dropped out right in the beginning. But since they dropped out right in the beginning, it did not have any negative outcomes on the results. 10 men and 4 women between the ages of 21 and 27 participated. And in order to be included in the study, participants could not be colorblind because the task in the study required you to see color. They were also not allowed to have a mental disorder, and they also had to be low to moderate activity. So all subjects were randomly assigned supplements, and they were to take 20 tablets throughout the day at hours 8, 12, 16, and 20. And that was about 20 grams of creatine that they were taking. And yes, that is a lot of tablets to be taking. So it only happened 1 week at a time. They were also not to change their eating patterns, their activity, or sleeping patterns during the day. And then half were assigned to this intervention group, which was the creatine, and then the other half were assigned to the placebo group. And then everyone involved in these studies were also blinded to these groups. So the primary outcome of the study was just to determine if taking creatine supplementation would combat mental fatigue that was associated with visuomotor skills along with these cognition. So visuomotor basically is the ability to take in visual information along with that physical movement. So if you think about driving a car, this is a visuomotor task. So you have to visually take in the information around you, along with actually physically moving that car. And then the secondary outcomes, this would be how creatine supplementation improved that strength endurance. Okay, so I'm just going to go over a quick timeline and flow chart of how the study kind of worked. So the study was over 7 weeks. The first trial was a familiarization trial, and this is where they went over what was to expect from the next 2 lab visits during the study to kind of learn that routine. And then for 7 days, the subjects were either to take the creatine or the placebo, and then they came in for that lab visit. So these tests that were done were a hand grip, a flanker, and a visuomotor, followed by a 90-minute mentally fatiguing Stroop task. And then it followed again with those same tasks. And I'll kind of go over what those are. And then there was a 5-week washout period where they did not take the supplements, followed by another 7 days of taking the supplement, and then another lab visit with those same lab tests. So yeah, I'm not going to go into too much detail about what each task is, but I just kind of wanted to paint a picture for you of what they look like. So for the hand grip task, this was testing the strength endurance. So they basically had to squeeze that device in both hands. And then there was a flanker and a visuomotor task, and this task was testing for their psychomotor performance. So this was just how quickly they could react to that stimulus that was being brought onto them. And then the Stroop task was the cognitive fatiguing task. So for 90 minutes, they would have to say the color and not the word. And you can see that could be very tiring. So for the results, the flanker task accuracy increased after the mentally fatiguing task in both the creatine and placebo. So this was not statistically significant. And then for the strength endurance, it was improved in the creatine group for just the non-dominant hand. So this did show some significant outcome there. And then the visuomotor task, both groups were impaired after that mentally fatiguing task. So again, there was no significant outcomes there. But for the Stroop task, which this was the 90-minute mentally fatiguing task, the results were significant in that those who took the creatine actually did better at this prolonged cognitive task. So if you look on the graph, those who actually had a higher accuracy were lower on this chart. So this indicates that the creatine group did better, and this showed those significant outcomes. So this study showed that increasing creatine by oral supplementation resulted in improved physical endurance and prolonged cognition. Unfortunately, though, we do need more research in this area to see if it would benefit visuomotor performance. But it is suggested, however, based on this particular study, that creatine might only have a positive effect on the brain when the task is complex. And again, based on my EAL worksheet, I gave this study a positive score. So again, it was a randomized, double-blind design. They did test the cognitive levels starting at the very beginning so they could kind of see how that would affect them at the end. Nobody really dropped out throughout the study except right there at the beginning. And then it was applicable outside of the research setting. And then for the limitations, it was a short study period, no record of a typical diet. It was not indicated, though, if the subjects were compliant with taking their supplements, and then there was no study limitations that were discussed. All right, so for my last article, cognitive effects of creatine ethyl ester supplementation. So ethyl ester is just another specific type of creatine supplementation. And the actual benefit of this one is that it does not cause any type of water retention or bloating. And then the purpose of the study was just to see if ethyl ester improved performance in 5 different cognitive tasks. And these all measured spatial ability, memory recall, response inhibition, and reaction time. So in this study, there were 22 men and 12 women between the ages of 18 and 24 that participated. There were 34 people who were selected to complete the study, and then 3 from each group dropped out during the study, and they did not show up for that second testing day. There were no inclusion criteria, but for the exclusion, they were not a vegetarian, no diagnosed psychiatric disorders, they could not have diabetes or renal insufficiency, and they could not be currently taking any type of creatine supplementation. And then all subjects were randomly assigned to the creatine or placebo group. Everyone involved in the study was blinded to the groups, and it was also a crossover design. So the primary outcome of the study was to determine if taking creatine would improve cognitive tasks such as memory recall and spatial ability. And then the secondary outcome was just how the supplementation would affect reaction time. So again, quick timeline. For the first day, participants completed the first round of computer testing, and at the end, they were given their supplements. They then took that supplement for 2 weeks, and on day 15, the participants went to the testing center to do the second phase tests. So these were 5 different computer cognitive tests that they were to perform. And all the tests were based on memory and reaction time. And they're about 3 to 7 minutes in length. And then the last test was the IQ test. And this test asked questions that gradually increased in difficulty over 40 minutes. So based on the analysis of the computer cognitive test, there was no significant difference between the two groups at baseline. The only thing that was significantly different at baseline was that the placebo group actually did much better at the IQ test than the creatine group, but this all changed after the creatine supplementation phase. So creatine ethyl ester seemed to improve performance in most of these tests. Did improve reaction time for all of the different tests, which was significant in that aspect. And then these results indicated that creatine seemed to improve basic cognitive functions such as IQ, attention span, and working memory. So these results were similar to my first research article in the way that it also improved reaction time and basic cognitive functions. So for the conclusion, cognitive ability really did improve by taking this type of supplement, and it was most significant in that it increased IQ, attention span, and working memory. So again, I wanted to give this article a positive score, and I'm not going to go through all the strengths and limitations since it's very similar to the last two, but something different was that it was a crossover design, so they compared the results to a previous study, which was actually the first study that I talked to you guys about. And then again, it was applicable outside of this research setting. So as of now, it's not recommended to prescribe creatine to patients, but it is important to be able to give them that appropriate information and to let them know the risk or the safety of the product, and then they can make their own judgment. So this is valuable information for the RD because it is in our scope of practice to really talk about supplementation and to give them the appropriate information that they need when they ask for it. If somebody does not want to take any type of creatine supplementation, you can let them know that you can get it through eating a diet that's rich in animal protein sources. But maybe those who eat a plant-based diet would benefit the most from taking creatine and in terms of improvements in brain function. It is also advised not to give supplementation to those who have a kidney disease because it can help or it can already damage those kidneys. And then it is advised that if somebody does want to take supplement, that they would be safe taking about 2 to 5 grams per day. And since creatine does cause water retention, it is important to take this supplement with lots of water to prevent any type of stomach cramping. So generally, creatine acts as a backup energy store for ATP. So in tasks that are going to require a less demanding cognitive task, your brain doesn't really need as much ATP. But when the task is more demanding, your brain is in greater demand for that ATP. So based on my research, creatine supplementation could mostly benefit those who are in need of more brain ATP. So unfortunately, we do need more research in this area before creatine can be said to be effective. Overall, though, it is clear in some areas that creatine can enhance some cognitive performance for a very high demanding cognitive task. And since creatine is considered safe, it won't hurt you to do your own research and to try it out on your own. And then these are my resources. And if you guys have any questions, and questions.
Okay. Kayla, so like I said, we'll open it up to questions now. So if anybody does have a question, you can type it in the chat box, and then I'll read it out loud for all of us. So I'll just give you a few moments to type any questions that you have. All right, so if there are no questions, thank you again, Michaela. Nice job. Before we leave, everybody could please just remember to click on the survey link in the chat box just to provide some feedback for Michaela. And then you are free to choose your next presentation, which will begin at 10:25. And the links for both of those are provided in the chat box as well. So thank you everyone for attending, and thanks, Michaela.
Thank you.